to be your student nurse today. Can you tell me your name and date of birth? Okay, perfect. All right, so I'm going to be getting an IV started for you. Do you have any allergies or anything? All right, perfect. So I'm going to be doing my hand hygiene, and throughout this entire process, I'm going to remember to keep in mind my 11 rights and everything. I'm going to keep in mind all of my general principles and safety practices. All right, so I've done my hand hygiene, and I'm going to put on a nice clean pair of gloves. And I've already got all my supplies gathered here, so I'm going to go ahead and find a vein here. So I'm going to place the tourniquet about 3 to 4 inches above where I want to insert that IV. Okay, and I'm going to clean the spot I selected. And I'm going to let that dry for 30 seconds. And while that's drying, I'm going to go ahead and flush my J-loop here. Okay, so that's good. And that has been 30 seconds, so it's all clean and dry now. So I'm going to take my needle, and I'm going to make sure it is bevel up. I'm going to anchor, and I'm going to insert at a 15 to 30 degree angle. And once I get a flashback of blood, I can go ahead and remove the tourniquet. I'm going to hold right above the site, but I want to make sure it's not on the site. I'm going to stabilize the catheter, remove the needle, and I'm going to activate my safety and dispose of it in the sharps. While I'm making sure to not touch the actual injection site there, I'm going to go ahead and hook up my J-loop while stabilizing the catheter. We don't want that going anywhere. I'm going to take my Tegaderm here. And we're going to cover it. We're going to make sure it's not taped on the injection site or where the J-loop is hooked. We're just going to cover, we want to be able to see the injection site clearly. I'm going to place that down there. And then we can use more tape to anchor it down. Already got my tape set out here. So here we can tape down here, just so it doesn't go anywhere. Okay, so we're going to want to flush this again. All right. And then we can actually tape this part down too, just so that it's good and secure. All right. So once we've got that placed, we're going to remove our gloves, do hand hygiene again, and we're going to get our fluid set up. So we've got new gloves on. We've got our primary infusion set. We're going to make sure that it's clamped. All right, so make sure we don't have any tangles. So we're going to remove this cap and this cap, and we're going to not touch these because they're sterile right now, so we want to keep them that way. I'm just going to twist that in there. I'm going to flip the bag. go ahead and hang those fluids. And we'll get these. So at this point, we can go ahead and unclamp it and open the drip chamber and get, I'm gonna fill this to about half full, and we should get some fluids running through here. So we're good. We can go ahead and close that again. And go ahead and hook this up. And we're gonna wanna clean this really good before we get that hooked up. So we'll scrub this hub really good. And then we'll go ahead and hook that up. And we're gonna set it to the prescribed drip rate. All right, and we're going to be assessing this IV site throughout the entire process. So we'll come back and evaluate it, of course, and we're going to want to monitor the patient for any type of reactions or anything, and watch the site really well. We're going to make sure we date and time and initial this spot right here. Well, we can peel that off and then do that, and then we're going to document, report, record, and come back and evaluate.